Disturbing video from Abuja has highlighted the deep cracks in Nigeria's healthcare system after a heavily pregnant woman carrying twins lost them while struggling to access care. The woman already in labor was seen trekking through the streets seeking help after being asked to provide 28,000 naira and a referral letter before hospital admission. Exhausted and malnourished, she attempted to retrieve the letter from her clinic in Mape, a journey of over 17 kilometers. A concerned citizen assisted with transport and basic supplies, but by the time she returned to the hospital, both babies had died. The tragedy reflects preventable systemic failures, as it were. Experts warn that Nigeria's referral system, still heavily paper-based, causes deadly delays. Calls are growing for digitalized healthcare records, expanded access to medical obstetric care, and scaled-up insurance coverage so no woman is denied treatment over money. The case also highlights maternal undernutrition, which 1 in 5 Nigerian women undernourished and over 60% of pregnant women, anemic factors that worsen outcomes for mothers and babies. Stakeholders insist that every maternal and neonatal death must be reviewed under the National Surveillance Framework with accountability enforced. They stress that reforms, including expanded nutrition interventions, digital referral systems, and financial protection schemes, are urgently needed. No woman should have to choose between paperwork, poverty, and survival. This mother's loss is another reminder that maternal and newborn deaths must never be normalized. I don't know if you got to see this video of this particular incident when it happened. I mean, she was walking, I think it was a content creator lady that saw her and offered to, let me give you transport to where you're headed. And she said, oh, I don't need the transport. I'm just leaving the hospital. I was asked to bring 28,000 and I don't have it. If you can give me this 28,000, I'll be very grateful. And the lady followed her back to the hospital and paid the 28,000. Then it was time for referral. Then she had to get her baby kits and all that. She didn't have those. So the lady took her and they went to sort it out to buy it and came back to the clinic. She was now referred. Lots of, referral. In all of this picture, her husband was home. Stories have it that he's unwell or he was home, but she was alone moving through all of this, and sadly she lost the babies. What are your thoughts on this when you look at the story realistically?
It's horrible. It exposes the rot in our system, and also when we even talk about rot, in some cases it's not just rot, it exposes the lack of progress, the retrogression in some cases. But again, retrogression may be a good word in some cases. Retrogression suppose that we have moved forward, then moving backward again. In some cases, we have not even moved at all. We have been stagnant. Like the news says, paper referral. Now, I wouldn't want to completely rule out the place of, putting your referral on papers. But in our today's world, where systems are all over the place, IT and all that, even the referral that should be on paper would probably have been typed. Now, if it is typed, if we have an effective IT system, from that same system you printed out the one you give to the patient, whether it's a pregnant woman or any other thing. From that same system, if we have interconnectivity to our hospitals and other, the same doctor, the same medical personnel who's referring it to be can also online there with the same gadget she used to type that he or she used to type that referral sent to you, also forward it to the hospital where the referral is being made, and probably a call can be put through. Is this so medical facility? You are referring so person to you. Expect the person in so time. So if there is even a need for preparation, some preparation can be made awaiting the arrival of that patient, rather than a situation where the patient goes there, has the paper, all they have is the paper, the receiving hospital. We are not expecting you. If there was, we have had cases where patients who were on oxygen died because they were being moved from hospital A to hospital B, moved from the hospital bed before you bring oxygen and all that, then, on getting to the other hospital before those short time of removing the oxygen, trying to get oxygen, something went wrong. But if there have been like they say, digital connection, but beyond the internet, even a proper phone call to ensure that that guy sent a message. We do it individually. I could send you a message and still put a call to you, because at the time you send the message, the last thing on my mind may be to check my message platform. Well, a call to say, oh, I sent you XYZ message, especially when it's considered urgent. Can you please check? Can prompt me to check? Such calls can make preparation, and it can make a whole lot of difference between life and death.
Right.
Then the issue of money.
Before you even get towards money, I want us to talk about what is an emergency. At what point does, when you get to the hospital, you always see emergency units, what's it called, critical units and all that. At what point, what state does someone has to be in for emergency care to come in? Now, this lady has come into the hospital. Obviously, she was in active labor. Why was the referral the most important thing in all of the structure?
Well, it's possible that before I try to define what emergency is in my own words, it's possible that that referral may also be very necessary to save her. It's possible that her case may not be one which that particular facility can handle. If they attempt to do anything, things may go wrong. But again, if it is an emergency case, walking the distance is enough to exacerbate the issue. So if it's an emergency case, the right thing would have been to throw her into an ambulance. And I mean, that's why we have ambulances and everywhere. Quickly get her
do you
to the
think
hospital.
they should have been thrown into an ambulance when she was being told to make sure she pays 28,000?
That now raises a question of what an emergency is, like you said, and how serious do we take emergency? How emergent is an emergency? Now, for me, an emergency is that situation which, if not immediately attended to, could lead to something grievous, if maybe fatality also. And that's why in quite a number of hospitals, the accident and emergency, they are always, most of the time seems to be on the same department. They're always at the core entrance or at the entrance of the facility where the person comes in. You immediately, I mean, you are not looking for where there is the emergency, or it's obvious for you to see the person is rushed in, and the person is taken care of, because like I said, it's that situation, whether it's medical or otherwise, that if immediate care is not given, something unwanted would happen, something wrong would happen. Now, this again raises the question: if emergency is that situation where if nothing immediate happens, if immediate care is not given, something could go wrong. How come we have? I don't want to pretend that my definition is the final authority, but this is what I think and how we treat emergency. Now, if my definition is anything to go by, how come you have emergency situation in our hospitals or even and the person, the said emergency would still have to be given a tax that will take some hours to accomplish, like go get your referral paper, like if there is no money, you can't be treated. Like I said earlier, money is very, very important in treating our people in medical care, the consumables and all that. But in some climes, this is why, because we also know that no matter how well a society is planned, no matter how the economy is moving, there would always be that situation, at least for a few persons or if not more people, that at particular times they may not have the wherewithal to take care of an emergency situation. We also know that in spite of the fact that pregnancy...
Are we talking about this financially now?
Yes, in spite of the fact that pregnancy is 9 months, it's still common some people like an emergency, like it just happened the night before. For more reasons now. But you see, if we can deal with that situation where will you pay the money? Yes, but payment of the money should not stop if it's an emergency case, should not stop immediate treatment. I mean, that's why health insurance, national health insurance and others should be taken seriously. But the question again, how many people have it? How many people, have it in the real sense of the word, have it? It's one thing to be registered and captured there. It's another thing to have an accessible insurance as at when needed. Right.
Now, you have raised several salient points as regards this particular discourse. One, I want to, take you back a little bit when you talked about finances as regards, 9 months. Pregnancy doesn't have, deliveries and labor doesn't happen in a vacuum, except it's premature.
Absolutely.
Right? A whole 9 month span to plan through this. 9 months to prepare. 9 months to gather a few baby things. 9 months, basically. 9 months, a year is about 12 months. So 9 months is almost a year. just 3 months short of a year. Why do you think people are not even prepared before this time comes?
Economics would be one of them. You need money to buy the baby things and all that. But if you live in a system, which most of us do, that you probably have had neighbors or family people who has previously given birth, and you know your situation that at this point in time I can't afford to get.
Why are you getting pregnant if you cannot afford to get what you need to have a baby?
Let's say things can happen. People are married, they have sexual relationship, whether they're married or not, the pregnancy happened, there is no family planning, there is no contraceptive, and it happens. Now it has happened. You have to face the realities. You can't afford to buy new baby things.
She already had 4 children prior, by the way. Just to give you a base.
Now, if the previous children have been taken care of with some basic baby things, except the consumables that are recurrent that you have to buy, the other things like the bathing stuff and all that, even clothing, you can use from the previous children you had, or maybe you have some neighbors, some family members, oh please, at this situation, you had a baby.
If she had all of these people, doesn't it bother you that she was doing all of this alone
she may
by
have
herself?
all of these people, but they are
we are known to be a communal people.
No, you see,
going to the hospital alone in active labor.
No, you see, going to the hospital is one thing, but having these materials is another. You see that you have these people who may be, at times it requires you asking that please, I'm at this stage now. You had a baby some months back, a year back or two. Please, the things you use, can I access it? Can I have it for my baby? I can't afford to buy new ones now. They probably would help. But if you don't ask, they may not know, because at times people are also careful to make offers. Let it not be like, offering you this. Am I saying you can't afford it? Are you trying to say, see, finish now? So you, at times, except I know your story very well, I may not be able to offer this. But if the person asks, it becomes easier to look around and see what can be raised. But I've already said that 9 months is no emergency, but people also find themselves, and this is the reality of life, that no matter how much they plan, they can't do certain things. If, for example, a man who is not working, a lady who is not working, they don't have a means of income, what are they really going to plan? Their planning would be possibly getting from people. Now, the question you ask is why get pregnant? But a part of the story it suggests that maybe the husband was sick or something, or is sick. Maybe let's assume something went wrong somewhere along the line. But if you also consider that pregnancy is a matter, in some cases, and depending on how it's handled, it can be a matter of life and death. Care should be taken how it is dealt with. If you can afford it, if you can avoid it, don't get pregnant when you're not ready, or when you can't afford it. You may think you're ready and you may truly be ready, but the financial aspect of it is not there. If you can, especially
because children are expensive.
Absolutely, especially for somebody who have children already. If it is a new couple who have not had children, there's a limit to which you can blame them. But if you already have 4 children, that you even have 4 children and going for the 5th one, when people who has all the luxury can't even afford 3, 4, not because they can't get pregnant, but because they're trying to manage. So it's also so. But again, we don't know the level of education and exposure of these persons, because when we talk about family planning and all sort of planning, your level of education also could determine what kind of planning you have. The more educated you are, and education not just in school terms, not just school education, but exposure. The more exposed you have, the more education you have, the more you're likely going to plan, even to the basic things you wear. But the other guy who is not that exposed can feel like, I wake up in the morning, any clothes I see, I wear, in spite of the occasion he's going to. So I think those things play.
Thank you so much for your